Namaskar, friends. On behalf of Global MEDI Talk Show California TV Live, here in the studio we are having with us Dr. Manoj Tayal. Dr. Manoj Tayal is the Director Cancer Institute from Max Super Speciality Hospital. Welcome, Doctor.
Thank you, Deepti.
Dr. Manoj Tayal is the Director Radiation Oncology from Max Super Speciality Hospital. He was also the Associate Director of Radiation Oncology from Medanta Hospital, Gurugram from the year 2009 to 2022. Dr. Manoj Tayal was a specialist in radiation oncology from Royal Hospital, Muscat from July 2008 to October 2009. Dr. Manoj Tayal has also joined Artemis Hospital as a classified specialist for radiation oncology in the year 2008. Dr. Manoj Tayal has started his career as a senior resident in radiation oncology in Rajiv Gandhi Cancer Institute from January 2005 to January 2008. Dr. Manoj is a eminent member from Association of Radiation Oncologists of India. He is also a member of European Society of Radiation Oncologists and FAJ Manipal. Dr. Manoj holds a special interest in total skin electron therapy, in total body irradiation. He also holds a special interest in stereotactic body radiation therapy. Dr. Manoj holds a special interest in intensity modulated radiation therapy, that is IMRT, IGRT, and VMAT. Also, he holds a very keen interest in brachytherapy. So, Dr. Manoj, you're a very senior super specialist, and it is an honor and privilege for us, for California TV Live Global Meditalk Show, that you have joined us. And in your busy schedule, I know you are a very busy super specialist doctor, and to seek your time was very, very valuable for us. Now, sir, we
Thank you,
will
Deepti.
start the session. My first question goes to you. How do you stay updated with the latest advancement and technologies in radiation oncology?
Yeah, Deepti, radiation oncology is quite evolving. In last 20, 25 years, there has been a lot of changes how radiation therapy is done. Earlier, when I joined my career, it used to be cobalt therapy, but, with advancement of computers, advancement of, newer techniques, with the advent of, the linear accelerators, the radiation therapy technology has seen a sea change, and to keep ourselves abreast with the time and with the advancing techniques, we also need to get trained ourselves. We need to visit those places who are doing these treatments, who are well ahead of us. So, and at the same time, we conduct a lot of training ourselves also. So we have to be very dynamic in this, and we have to talk to our colleagues here in India, in abroad also, and we talk a lot about what is happening new and what we contribute. So even we also contribute. We also publish our own data to update our own colleagues as well. So it's quite important for us so that we can give equally good treatment that is done, in the Western Hemisphere. Like recently, I was in Sydney last week, and I had, seen how a newer advanced technology called adaptive radiotherapy, in which the patient who is on treatment, before starting the treatment, you do imaging, and you see how the tumor has changed its shape, or maybe it has moved from its own location a bit, so we can modify the contours of the target, and then we can make a new plan for this patient. So I was in Sydney just to see this last week. So we keep ourselves well abreast with the the technology of today, so that we can give best treatment to our patients.
Very rightly said, Doctor. My next question goes to you, that what techniques do you use to minimize the side effects and maximize the effect of the radiation therapy treatment in oncology?
Yeah, so in olden days, people were very scared of radiotherapy treatment because that time the modulation was not there. Whatever beam comes out of the source, It was just being given, you know, it was very difficult to give shape to the beam, and very limited directions of treatment also were available. But right now we have many techniques like intensity modulated radiotherapy, we have volumetric modulated arc therapy, that is VMAT, and at the same time we have image guided radiotherapy also. So all these techniques allow us to, irradiate the tumor to the maximum dose, and at the same time we reduce the dose to the adjoining normal tissues. So it is quite important to use these advanced techniques to, improve our. We say that therapeutic index, that is the ratio of dose to the target versus the dose to the normal tissues. So, the larger the ratio, the better treatment outcome. So, we use all these newer techniques, and at the same time to maintain the accuracy, because what is being planned in the computer has to be delivered by the machine, and in the same way. So, quality assurance also becomes quite important. So, we have to take all these things into account and deliver the treatment. So, based upon the location of the tumor, size of the tumor, and the biology of its growth, so we decide upon the total dose per fraction, and how it is to be treated. So this is the way we try to reduce the side effects around to the patient. At the same time, do not compromise upon the cure of the tumor.
Yes, doctor. My next question is, how do you determine the most ethical and precise way of treatment plan for each patient?
Yeah, so every tumor, every site is different. So we have to have a individualized plan for every disease. I cannot give the same dose to head and neck cancer as it is required for a cervical cancer or maybe a breast cancer. So I have to decide my dose based upon the biology of the tumor, the location of the tumor, and at the same time whether the tumor is being treated in the post-operative setting, or radiation being the only therapeutic treatment, or if the patient requires radiation therapy as a new adjuvant treatment before undergoing surgery. And before decide on all these treatments, because cancer treatment is not a single person's job. I cannot say that being radiation oncologist, I am capable of doing everything, and I myself will cure this cancer. So we discuss all these cases in our tumor board, and in our tumor board, we have our medical oncologist sitting with us, the surgical oncologist sitting with us, the radiologist is there, pathologist is there, our dietitian is there, and other additional staff as well. So all these people, when we reach to a consensus, then only we start our treatment. So it becomes very ethically important for me also to give respect to all my colleagues, and then come to a final conclusion for this patient. So the tumor board settings are very important for our patients. So and at the same time, when we say ethical, ethical towards a patient and ethical towards a society, I cannot say that I'm sitting in a private setup, and whatever revenue we have to generate, we should be compromising on our ethics. Never. So for us, the patient is paramount, and we have to follow all our protocols to give the best to the patient.
Sir, what is your criteria to handle those special patients who are having a lot of side effects with radiation therapy, sir?
So, with the newer techniques, we see side effects, but not as severe as they used to be in the olden times. So, yes, I'm not denying that there are no side effects when the patient is getting treated. Say, when we are treating the head and neck cancer patient, the patient is having tumor in the oral cavity, or the patient requires radiotherapy after surgery. So these patients will develop mucositis, will lead to dysphagia, odynophagia, malnutrition. Their change in their taste, so that they are not able to feed themselves well. So all these patients, we first they need a lot of counseling. We have to you know train them. We have to let them know that what are the things going to happen to you during the course of treatment, what will happen in week 1, week 2, week 3, week 4, week 5, week 6 also, and what will how will they recover from the side effects. And at the same time, we take the help of our dietitian, we take the help of our dentist. Before the patient goes for radiotherapy, we get the dental hygiene also checked by the dentist. If any patient requires any dental extraction, we get the dental extraction done prior to starting radiotherapy. If any patient requires any filling, those filling also need to be done. And if any patient requires any kind of a special diet, then those dietary instructions also are given very clear to the patient. And every patient is different. I cannot label one chart for all the patients together. So every patient has to be given attention as per their need. And this is one thing. And another thing is when we are planning radiotherapy, when we are marking our targets, when we are marking our normal tissues, we have to be very meticulous in this. I cannot be, you know, I cannot be in a hurry and then do whatever times allow me to do and compromise on the patient's target delineation or normal tissue delineation. So we have to be very meticulous in this, and at the same time, we have to be very meticulous in our dose planning, dose prescriptions. So we sit our dosimetrist, medical physicist to get the best plan for the patient without compromising the dose to the target. We try to reduce the dose to the normal tissues, like for parotid glands. The patients who are going to receive radiotherapy to the head and neck region, they might suffer future xerostomia. So to reduce xerostomia, we discuss with our physicists, we reduce the dose to the parotids, we reduce the dose to our submandibular glands. And we have to, we should know the anatomy well, we should know the biology of these cells well, so that our planning is not getting compromised towards the target, because the target might require 60 gray or maybe 70 gray, but parotid tolerance is only 27, 28 gray. So we have to then decide which kind of technique we will be able to use to reduce this dose. So IMRT or IGRT or VMAT is a very good technique to reduce the dose to the parotids. So I'm just giving one example for one particular site. Say for breast cancer patients, these patients, when they undergo chemotherapy, when they undergo surgery, they are already organ functions are compromised. There are so many chemotherapy drugs which are cardiotoxic for a left-sided breast tumor patient. Whatever possible way we can do to reduce the dose to the heart is going to be beneficial to these patients, because these patients are going to survive maybe 15 years, 20 years also, because cardiac problems related to radiation we are not going to see tomorrow or maybe 5 years. This toxicity might be seen after 15 years. So we have to work towards that today itself. So when we are treating left side breast cancer, we do that with deep inspiration breath hold. So what is deep inspiration breath hold? The patient is trained first to get acquainted to this technique, so that they take a deep breath inside and the lungs expand like a balloon, so that the lungs push the chest wall towards the front and the lung towards the back. So it creates a distance between these two. So the chest wall is my target and the heart is my organ at risk. So with the creation of a distance, my radiation dose also reduces. It is quite laborious for the patient also, for us as radiation oncologists, for my technologist also on the machine. And it is time consuming, but we do not compromise upon that. So, so to use all these techniques, we reduce the dose to the normal tissues and reduce the toxicities, whether it is the acute toxicity which we are going to see during the course of radiation, or the toxicity which is going to come in future. We call it as late toxicity. So we reduce that as well. For cervical cancer patients, when we treat the cervical cancer, the bowel is there in front, the urinary bladder is there in front, the hip joints are there on the side. So with our meticulous planning, we can reduce the dose to these structures, so that when they get cured of the cancer, their quality of life in future should not get compromised. So they should not be cursing us that, okay, doctor, you have cured me of cancer, but you have given me a newer problem, which was, which I find little more problematic as compared to cancer. It would have been better if I died of cancer without, if I'm facing all this. So with the current technology and how we plan our radiation, we reduce the doses to these normal tissues so that we maintain a very good quality of life for our patients. Yeah.
Yes, doctor, I just want to understand that what equipment is needed for stereotactic radiation oncosurgeries.
Okay. So, stereotactic radiosurgery, we call it as SRS also. It's a very, very good technique. You give radiation, very fine beam from multiple angles, you know, uh, from different directions, so that the maximum dose is given to the target, and there is a very sharp dose fall off outside the target. So generally, people know that stereotactic radiosurgery is done through gamma knife, but gamma knife is only for brain tumors. But right now, we have many other equipments available to do stereotactic radiosurgery. Like we have X knife. So this is a linear accelerator based, stereotactic radiosurgery system. Then there is a robot mounted linear accelerator. We call it as cyber knife. Even cyber knife is a robotic radiosurgery system. So these are the different, SRS machines available to us. Now, recently, there's a newer SRS equipment being available called as ZAP. So ZAP is the gamma knife equivalent linear accelerator based SRS system. So these are the different equipment available to us. So it's a gamma knife, it's a linear accelerator based SRS system. We call it as true beam or edge system. And we have a newer ZAP system. Then we have cyber knife system for SRS. And Deepti, I can tell you that I've been very fortunate that I've been, I have a very good experience that I'm used all these techniques. So right now I'm using a, linear accelerator based system. We call it as TrueBeam STX, which is having, the floor mounted X-ray tubes for exact track based, system to do intrafraction image correction and position correction, and I have experience with CyberKnife as well. So I've been doing SRS since the year 2009. Deepti, are you there?
আমি মালিগাঁওয়েরই মেয়ে, আসামের। ২০২২ সালের ১৮ই অক্টোবরে রাত্রিবেলা উনার ব্লাড ভমিটিং হয়। তারপরে আবার ব্ল্যাক স্টুল হয়ে গেল। আমরা ভীষণ চিন্তায় পড়ে গেলাম। সাথে, সাথে রাত্রিবেলা আমার ছেলে-মেয়ে আমরা সবাই মিলে উনাকে হসপিটালাইজড করলাম এনএফএলএ মালিগাঁওয়ে। তা
Yeah,
তারপরে
so this
ওই
patient we have
মনোজ স্যার
treated for
আমাদের এখানে ম্যাক্সের হসপিটাল থেকে
liver
মেডিকেল
cancer.
কনফারেন্সে উনি আমাদের হসপিটালে গিয়েছিলেন।
This is patient's wife.
তারপরে আর কি মনোজ
So
স্যার
this
বললেন
patient
যে
had come
আমাদের
from
ম্যাক্স
all the way
হসপিটালে
from Assam
এসে পড়ুন, এখানে ট্রিটমেন্ট
to be
আছে। পরে
treated by
তারপরে
us.
আমরা ম্যাক্স হসপিটালে চলে আসলাম।
हम बात
Yeah.
करेंगे पेशेंट मिस्टर प्रबीर रॉय चौधरी के बारे में। ही इज़ अ 61 ईयर जेंटलमैन। ही इज़ अ रिटायर्ड रेलवे ऑफिसर एंड जिनको अभी रिसेंटली जस्ट रिटायरमेंट के बाद पता चला कि उनके पेट में उनको कुछ हैवीनेस महसूस हो रही है, कुछ भारीपन महसूस हो रहा है। तो जब वो गए अपने डॉक्टर को दिखाने के लिए, तो स्वाभाविक है कि डॉक्टर ने जब एग्जामिन किया तो पाया कि भाई पेट में कुछ डिस्टेंशन है, ऐसा लगता है कि पेट में कुछ फ्लूइड इकट्ठा हो रखा है।
তো এখানে আসার পরে ট্রিটমেন্ট শুরু হলো। ওনার পেটের জলটাও অনেকটা বের করে দিলেন। তারপরে রেডিয়েশন শুরু করলেন। তো উনি এখন মোটামুটি আর কি স্টেবল হয়েছেন। তাই রেডিয়েশনের থ্রু দিয়ে উনি কিছুটা এখন আরাম পেয়েছেন।
अंदर लिवर में जिस लोकेशन में वो ट्यूमर है वो थोड़ा सा ऐसी लोकेशन में है कि उसकी सर्जरी करना एक मुश्किल काम होगा, शायद सर्जरी ना हो पाए। लेकिन क्योंकि हमारे पास हमारे पास सारी टीम अवेलेबल है मैक्स हॉस्पिटल पटपरगंज में, तो हमने गैस्ट्रेंटरोलॉजिस्ट से कंसल्ट किया, जो ऑन्को सर्जन्स हैं उनसे कंसल्ट किया, और सामने बात ये आई कि इनके ट्यूमर के लिए अगर कोई बेस्ट ट्रीटमेंट ऑप्शन अवेलेबल है तो वो है लिवर ट्रांसप्लांट, एंड रेडिएशन ऑल्सो कैन बी डन फॉर अ लीजन लाइक दिस। हम उसको आज के मॉडर्न तरीके से रेडिएशन ट्रीटमेंट करेंगे ताकि हम आपको जो है लिवर कैंसर भी खत्म हो जाए और हम आपको आगे और आने वाले जो समय है वो भी आपका अच्छा निकल।
আর খুব কমফোর্টেবলি এটা নিয়েছেন, তো ওনার কোনো অসুবিধা হয়নি, সেজন্য ধন্যবাদ জানাই ম্যাক্স হসপিটালে। আর আমরা এখানে থেকে খুব সুবিধা পেয়েছি।
मैक्स का सर्विस बहुत डेवलप्ड है और हर आदमी ऊपर से नीचे तक कोऑपरेशन करता है और नीट एंड क्लीन है।
पेशेंट हैज़ बीन वेरी कंफर्टेबल, ना ही पेशेंट को कोई उसमें ट्रीटमेंट के दौरान कोई साइड इफेक्ट को, एंड ही हैज़ बीन डूइंग वेल।
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.
Very nice reviews and the videos we have shown it to our viewers. Doctor, my last question goes to you, that how would you stay updated with the latest advancements and the technologies in radiation therapies?
Yeah, Deepti, I told earlier also, it's very important for me to be, abreast with the latest techniques, because radiation oncology is quite evolving. Every day, we are seeing something new, and we have to train ourselves towards these new techniques. So we go to attend all these trainings wherever it is coming up for the newer techniques, as well as if we do something new, we share our data with our colleagues so that they learn from us. So, it's learning, and learning always goes on. So, being an oncologist, I cannot say that, yes, I've learned something during my MD days and then it's enough. No, because I remember when I started my career as a radiation oncologist, there were very few limited machines available. Mainly, radiation therapy was being done through cobalt machines. But now, in the current era, the cobalt machine radiotherapy systems are available very less, are not used. So, if that was the case, I was out of my field. But now, right now, I'm using all the most advanced techniques available to me. So we train ourselves. We go to those places where these newer techniques are coming up. We also acquire these techniques. We ask our management to make available these techniques to our patients. So we have to be abreast with these things.
Thank you so much, Doctor, for coming in the studio and giving us such a valuable information about the radiation oncology, their techniques, their technology, and how precisely and accurate you are doing the treatment with the proper contouring, and you are assisting the patient with the help of tumor board. So you are giving a very good and very precise treatment with a targeted therapy. So we are very obliged and felicitated with your auspicious presence, and we highly recommended you as a doctor from our California TV Live, that you are the best radiation oncology in the country, who's really doing very well with a lot of experience, clinical experience from the Indian market as well as from the overseas. So stay tuned with us. Thank you so much. Namaskar.
Thank you. Thank you. Namaskar.